Not only do the malignant cells wreak havoc on your body, the malignant cells wreak havoc on your bank account.
I couldn't believe that I was completely alone and having to pay for something that I never even really asked for. I just thought that was wrong.
It's almost universal that young women in treatment have financial struggles. There's more co-pays, there's less time to work, and you put those things together, and even the most fantastically rich person is still going to notice that there's a difference in their income. There are a multitude of costs that come with getting a breast cancer diagnosis. Some of them are pretty obvious. You have to pay for your doctor's appointments. You have to pay for medication at the pharmacy that you never needed before. But there are a lot of costs that you don't even think about.
Even though I have a health insurance and it's very good, I still receive bills that I needed to pay. There's for example, Exhiva, which is for your bones. My insurance cover only 90%, so the other 10% is $280, around that, and that's once a month.
Some of the costs that I didn't expect were the high price of testing. You have to get tested. I started getting migraines, and the cost for MRIs. Different things can be out of pocket upwards of $200 or more, and if you have to get more than one, and then the different bone scans that you have to get that your insurance doesn't pay for. At the age of 34, which I am now, you are expected to work full time. And prior to my diagnosis, I was making really good money, but I was working 70 plus hours a week. I'm lucky now if I can do 30. Just because of the exhaustion.
I would say the biggest cost that I did not anticipate was the fertility preservation. The shots are very expensive, and then housing your eggs is $400 to $500 a year until you either donate them or use them.
With metastatic disease, this is going to be a big chunk of your money for the rest of your life is going to be going towards treatment. Every year since I've been diagnosed, we've been $20,000 to $30,000 out of pocket in medical expenses. Thank God I can claim it on my taxes, but still, it's ridiculous.
Some of the things that are unique to young women while going through breast cancer, I would say right off the bat, you're not established. This is a time in your life where you're supposed to be figuring it out, and now this huge thing comes in and disrupts your life.
I didn't expect to be 39 and not working. I've been working since I was a teenager, and very responsible, and trying to figure out a budget, supporting 3 children on my own, and having breast cancer has been really challenging.
You're just starting your career. You just got out of college. You don't yet have that life savings or, that 10 or 20 years worth of savings to fall back on. You're probably not married yet, so you don't have, a second financial income. And you're busy paying off the debt from college in your younger years. So to have something like breast cancer come up, it's made a huge impact on my life for the past few years, and it's been really difficult for me to overcome, the debt that it put me in.
That it's okay to let people know what's going on, that finances are a struggle. The last thing your doctor wants to hear is that, well, you can't put this medicine in the refrigerator because your electricity was turned off. And there are people that happens to. You need to say something before so that there is some help to prevent these catastrophic things.
I did share my financial needs with my healthcare providers, and they were very good with informing me of different programs that might pay for co-pays or pay for testing and different things like this. So they were forthcoming with information. So if you don't let them know what you need, they can't help you.
My doctor referred me to the social worker and the nurse navigator, who quickly, helped me fill out all these applications. One from Living Beyond Breast Cancer and some other organizations that immediately stepped up and helped me pay some of my bills, my mortgage and utilities and things like that.
There are oncology social workers that have huge amounts of resources about finances and where to go to get assistance and information about things, are you eligible for a short-term disability policy that some people don't even realize they have coverage. There's just so much to know that one person can't possibly know at all. But the oncology social worker, if they don't know what the answer is, they know where to get it. There are some more creative ways that women can go about trying to cut their expenses. If someone's willing to help drive you somewhere and that, willing to use their car and their gas, then that can be helpful.
I've definitely been helped by family and friends. My parents' church has collected money for me.
I did ask for gift cards. If people ask me, what do you want? What can we do for you? And I would tell them a gift card to Walmart or money, because when you're not working, $5 from 5 people is $25 that could pay a water bill or pay a gas bill.
When I was going through treatment, I couldn't work, but I was living at home with my parents, so my mother was able to cover most of the transportation and co-pays, and luckily I have really good insurance through my father's work. I'm young enough where I'm still on his insurance plan.
If you're paying on a student loan, but you're unable to work for a period of time, getting in touch with the loan company and explaining your situation, they can give a deferment. They can work with you.
As far as I went with my family, and I almost felt guilty asking them for money. I kind of didn't tell them how much money I was owing on these medical bills, and I didn't want to go home and have that pressure put on them because I had already put a lot on their plates with my diagnosis.
Again, it's about letting people know the need and not being ashamed, not saying, oh, I don't want charity. It's not charity. You are sick.
Advice that I would give to a young woman who's just starting treatment would be to really feel comfortable relying on your community. You have friends and family, and there are organizations that are there to help you and provide support. And I would say, really don't feel bad or guilty about any help that you're going to receive from people, because this shouldn't have happened to you.
Think about your exact needs, whether it be financial, groceries, someone to take you to and from chemo. Really think about delegating those responsibilities. I know someone's going to take my kids to school. I know there's going to be food in the refrigerator, but I don't have to be responsible for everything. My responsibility is to breathe and to keep living.